is there any sign that can help us understand early signs of arthritis for someone who's very young?
Yeah, sure. Pain is the biggest phenomena. Once you get a pain, don't ignore the pain. Don't go for a painkiller.
Yeah.
Just go and check why the pain has happened. Don't suppress the pain with a painkiller.
So what are some health changes that you notice amongst professionals today?
Most of the young individuals, what are the software professionals, they have neck pain, back pain, and shoulder pain. People are completely sitting for hours together, or they're completely standing, or completely traveling. Work has to be inculcated all the three. You should sit for some time, you should stand for some time, you should walk for some time. But this is not happening nowadays.
What's your best advice to stay injury-free?
I always encourage sports, and they think that is a recreation for them and it is giving some lot of happiness from them. Good, very good. Without being sedentary, without doing exercises, it's better to play. Okay,
Yeah.
but you should have.
Hello and welcome to an episode of the Green Generation podcast, where we make science, wellness, and all of these solutions about health more sustainable. And I am Shruti Seetharaman, your host for today's episode. And joining me today is Dr. Selvam, who is a physiotherapist, a manuotherapist, a consultant, all from Sai Physiocare Chennai. He is a true expert in pain management and functional rehab, who believes in healing through movement and not medication. Welcome to the episode.
Thank you so much.
I'm going to shoot right to the questions, if you're okay with that. So I'm going to start from the top. Could you tell our listeners a little bit about yourself and how your journey in physiotherapy began, especially your work in pain management?
I'm Dr. Selvam. I have more than 20 years of experience in physiotherapy and pain management. I finished my basic qualification in Europe, and then I transferred to Chennai in my master's degree in orthopedics physiotherapy. Then I did my manual therapy. I have experience in sports management also. I did a course on sports management also. Then slowly I started in a small clinic. Then I did it to expand it itself, and we had a lot of patients, and we found some good techniques which works for the patients much more. So we able to give good relief for the patients, and we give result oriented.
Okay, so now my next question is, as a rehab specialist, what do you think is the real role of exercise in everyday life of a common person, especially for those of us who have more sedentary jobs where we're sitting in front of the laptop all the time, very less movement?
Exercise is everything. In my opinion, exercise is like food. You have to take food daily, no?
Yeah.
So exercise has to be done on a daily basis. People come to me say that we are working very hard. What is the need for exercises? We don't have time for exercises.
Yeah.
But that is not true. Exercise is like food. Exercise, in my opinion, is the bridging gap between your food intake and your energy expenditure. So you may take more food. You work in a sedentary lifestyle.
Yeah.
Only exercise can bridge this gap and make you healthy. So exercise should be inculcated as a daily habit, probably in the mornings. So every day you should inculcate exercises so that you lead a normal life and be a healthy person in this world.
Absolutely. And I think my opinion is, as much as I'm more of a night person, I still prefer to get my workout or exercise done first thing in the morning, because you don't realize it once it becomes a habit or a practice. It sort of starts or sets the tone for the rest of the day, which you don't realize until it becomes a routine and a habit. So, okay. And for someone who's just starting out, what's your best advice when planning an exercise program that's safe, consistent, effective, something that somebody can follow as a beginner?
In my opinion, exercise should always be tailor-made because the person to person, the exercise differs. Some person may be looking very strong and they are not capable to do some exercises.
Yeah.
So it should be tailor-made. There is no exercise which can be suiting for everyone. So to avoid injuries and to get back from exercises, exercise should be always tailor-made. You can consult a physiotherapist or a rehab professional, and they'll have exercise program for you, so that which is you go in a step-by-step way. Not into rushing to exercises, then you can end up in some injuries and you lift. So exercise should always be tailor-made. So you're based on your body level and your progression and your need and your work style and the time you can allot. That's more important. how much time you can allot. Based on that, they will prescribe you your treatment plan so that you can work it out.
Absolutely. So we're going to share some of Dr. Selvam's details in the caption below for all of you to be able to reach out to him if you do need help with an advice.
Sure.
But I truly believe that what you just said is the most important message, because a lot of us, including the gym, not just non-medicinal movement exercise, generally we always feel like there's a one size fits all. There's traditional workouts, you do it, you'll be fine. And like you said, that always almost can lead to injury, and how much time you can allocate for exercise fully depends on how you get a full body workout in, or whether you're focusing on a particular body part. I think that's a very, very good advice for everyone that's watching to sort of take in. Okay, now I want to talk about arthritis, which is becoming even more common amongst young people, sometimes even in their 30s. So can you tell us briefly how arthritis management has evolved in today's world and what we can do to sort of prevent or take care if we're facing something like that?
Actually, people think arthritis is coming after 50 years, but arthritis is starting at an early age, but it is unrecognized. See, in the sedentary lifestyle and the work style pattern has been completely changed. So arthritis has to be taken care of at an early age itself. So early prevention will postpone your arthritis progression so that you will be in a better place at the age of 50 or 60. So graded exercises, muscle balance and muscle, you need to re-educate the muscles and you need to strengthen your muscles and you need to inculcate the habit of exercises so that you can postpone your arthritis. Probably a lot of patients we see in the clinic with a lot of knee pain, they think it is starting from the age of 50, but no. It is arthritis. We are living with arthritis. We are living with arthritis. So we don't understand until we have pain or inflammation. So start it early. Have your ideas from your consult a therapist or a doctor or an orthopedist. Have some idea. Then you progress.
And what I want to ask you in between that is there any sign that can help us understand early signs of arthritis for someone who's very young?
Yeah, sure. Pain is the biggest phenomena. Pain and swelling are very good phenomena. Once you get a pain, don't ignore the pain. Don't go for a painkiller. Just look what for the pain. Pain is always a protection. Pain is something which is given by the nature to you to understand there is something inside. So always don't ignore the pain. Just go and check why the pain has happened. Don't suppress the pain with a painkiller.
Fair enough. We all think we're indispensable when we're young. That's not true. Pay attention to pain like Dr. Selvam is saying, and go and treat it. I'm sure we'll all be better off that way. Okay. And now what I want to ask you is, you treat a lot of working professionals.
Yeah.
So what are some health changes that you notice amongst professionals today?
Most of the young individuals, what are the software professionals, they have neck pain, back pain and shoulder pain. These three pains have been very common, because today the modern lifestyle is completely changed. What really happened is people are completely sitting for a house together, or they're completely standing or completely traveling.
There's no equal balance.
Yeah, equal balance. Work has to be inculcated all the three. You should sit for some time, you should stand for some time, you should walk for some time. But this is not happening nowadays. So what really happens is, when there is imbalance, you need to balance it only through exercises. So what I advise is, for these young professionals, don't sit prolongedly. Don't allow prolonged sitting. At least every 2 hours, get up from your seat, just walk a few minutes, just come back. Do some minimum exercises, what you could do at that place, in your working place, so that the muscles are getting relaxed in between. So the problem comes when one particular group of muscles keep on loaded and the other muscle is not being working. There is a muscle to work and muscle to relax. This is nature's process. So keep on giving more pressure to a muscle that is going to strain the muscle, then it will have impact on this joint.
Okay, good advice. Okay, so your tagline generally, I feel like, says pain relief without pills, right? So how exactly do you manage pain without medication?
See, we work on the muscles. The muscles are the soldiers. The joints is the king. So if the soldiers are healthy and they're strong enough, the king is safe. That's what it is. So we work on the muscles. There is an imbalance between muscles. There will be, for example, I'm talking about the knee joint. There's a lot of pain and knee surgery is happening over there. So you strengthen your quadriceps and your hamstrings. So there is interrelation between the two muscles. So one muscle is being highly affected, one muscle is not being working at all. So you balance it. Then we go for strengthening program. That is a big graded one.
Yeah.
Then we reduce the pressure on the knee joint. So in that way, we can prolong the life of the joint, and you can reduce inflammation. I can prevent the arthritis also.
Wow. Okay. And now for the weekend warriors, those who play sport occasionally, right? What's your best advice to stay injury-free?
I always encourage sports, and they think that is a recreation for them, and it is giving some lot of happiness from them. Good, very good. Without being sedentary, without doing exercises, it is better to play. Okay.
Yeah.
But you should have a proper warm-up. Even in a match, there is a pre-day program, which is even an elite player is taking a preview before that. But we people, we don't do that. They just straight away go to the ground, or straight away go to the court, tennis court or something else, and we start to play. We end up in injury. So what I'm advising them is, do a mimicking program, that is what is being needed for the sport.
Right.
Do the program or do the movement which is being working for the sport, so that the brain reads it. Brain should understand what you're going to do it immediately. So it will coordinate the muscles, and you will not end up in injury. Most of the patients who come to us are weekend players, because they don't understand what really happened. They won't start with it, and they don't follow these procedures. They don't do a proper warm up. They don't do a proper cool down. They just go on, play and come, and they end up in injury.
Yeah, and I think I've noticed this because, so in the Middle East, paddle, have you heard of paddle?
Yeah.
So paddle has become very, very common, and has become now an expensive sort of activity to do, and everyone's doing paddle over the weekend. And there's so many of friends of mine who've also said, oh, I feel like I have tennis elbow now. And I said, but how can you have tennis elbow so young? Like, you played paddle twice. Yeah. And I realized that, so I've played paddle a couple of times as well, and I realized that the one thing that actually helps me is because outside of paddle, through the week, I have a very fixed routine of 3 times a week going to the gym, 2 times a week going to dance class. So I do involve myself in some kind of like strength training or whatever, and then I do a very, very minimal warm-up, like, practice with the ball and the bat, or the racket rather. That helps, and I realized that actually is helping me prevent me from getting the injury, right? So I did not realize I was doing it that way.
Consciously doing it. That's so nice.
Yeah. So I think that's definitely great advice. Try and do a warm-up, try and mimic the activities, train your brain to sort of have muscle memory. I think good advice. Okay. Another question I want to ask you is, there's always confusion between exercise and diet. Which one plays a bigger role in staying healthy?
Actually, diet and exercise are interconnected. There's no bigger one, there's no smaller one. Each and every individual has their individual proportion. For example, a lady who is weighing more than 100 kgs, she can't do every exercise. For her, diet is more than 70%. 30% is exercise. For a person with 60 kg, exercise is more important. Diet is 40%. So it depends from individual to individual. So in initial level, and depends on the duration also. So in initial level, the same 100 kg lady, she's going to concentrate on more on diet. Then she will go for a weight loss. When she comes around 80 kg or 75 kg, she can add more exercises. So it depends on the duration and your body composition.
I really like that, because we always follow, again, that one size fits all, is that this 70% diet, 30% gym or workout, or 60%, 40%, right? And you've just now busted the myth saying it depends on person to person. So I think that's also something that is super, super important to factor in, is that there might be a certain diet chart that your nutritionist might give you, but you have to make sure that they cater to what your goals are and whether it works for your body. I think that is, again, great advice. Another thing I want to ask you is about a common concern that we hear is, how can people avoid knee surgery or back pain, and is it really possible to avoid?
Yeah, sure. Everything happens with the time. Time is the biggest factor. People come to clinics or go to the orthopedic surgeon, they are in the later stages. So when you find your pain, just address the pain. And what is your muscle blood? Get assessment. Physiotherapy is not about just treatment. It's about assessments. They look for range of motion. They look for muscle power. They look for your body balance, your walking pattern, everything they assess. And they give you a chart and they identify where the root cause is. So after it's been yearly been identified, The joints will definitely reduce your pressure on the joint. For example, for a back pain, most of the surgery is being done for a disc problem. The disc is not an independent entity. It is being governed by the muscles, strong muscles of your back. When the muscles are strong, it is balancing your disc. Definitely the disc is not going to push out.
Yeah.
So you try to address what is your problem, identify your problem, which muscle is working more, which muscle is not working, which is weak. So balance the muscle, go for a greater strengthening. Your disc is safe. Then why are you going to go for surgery?
No, and I think now this knee replacement surgery is becoming so common and knee issues are becoming such a prevalent part. I think this is great information for all of us to sort of take in to understand how we can prolong at least and might not need immediate. Because I believe in terms of knee surgery, back surgery, once somebody goes into the body, recovery will never be 100%.
Yes.
So it's always best to prevent. Prevention is always better than cure.
Yeah.
And lastly, what I want to ask you is about posture. And I think we all know how important it is. But how exactly does bad posture link to pain? And what is it that we can do to sort of fix our posture? Some little tips that you want to give our viewers.
People never understand what is posture right now. They are in their own way. Because mobile has come, laptops have come, the working style is totally different, different day by day. What really happens is they never understand we are putting excess weight on some muscles and we are working and just in a very bad position. So what you need to do is you need to understand where the posture, what posture you depend on your work, what work you're doing. So the right posture on how long we are being sitting for a longer time. So know that you need to balance your posture.
So I think balancing posture, is there any sort of exercises or any sort of tip that you would give us to like fix our posture if we know already that for example, I know that a lot of times after a couple of hours of sitting, I automatically start drooping.
Yeah.
So is there any way that I could consciously sort of fix my posture or do an exercise if I can't fix it, if I'm sitting for too long? Anything that you would want to give us?
Most of the time, software professionals, they go forward with the monitor, very curious to see the monitor.
Yeah.
So they need to come back. And people who are sitting, they sit in the other way for prolonged time.
I'm already doing that.
You put more weight on your right pelvis and you put less weight on your left pelvis. So the right is more affected right now. You may get a back pain.
Yeah.
Sit erect most of the time. You'll be in much better position. Even if you sit for some time, have a movement. Okay. The body will realign itself. Okay. Body tries to realign itself. Okay. But you're not allowing it. That's what it is.
I think this is beautiful advice and I hope all of you enjoyed watching this. I truly got a lot of insight from talking with you today, and hopefully all of you now understand that what we're trying to do with this podcast is try and create sustainability in every aspect of life, not just the environment. Of course, the environment is super important, but I think these are like everyday tips and goals that will help you stay healthier, make more sustainable choices. The healthier you are, the better you can work towards protecting the environment as well. So if you did enjoy watching this and if you were inspired, don't forget to like, share and subscribe. Like I said, I will add Dr. Selvam's details in the caption below so you can reach out. And stay tuned. We will see you in the next one.